Good morning, everyone. I hope I am audible and visible. Good morning, everyone. Okay. I know today is Sunday. You all might be chilling around. So, I will not take much of your time. It is only a 10-minute discussion, and that is very important topic for your MBBS. Actually, in NMC curriculum, there's a topic called as feeding behavior. Okay. So, right now, as a doctor, as an MBBS student, you all must know when we feel hungry, how we feel hungry, and what come you are satiated. I mean, the satiety behavior and the hunger behavior. Okay, so this is really a very important topic. It is given in your Guyton, Genong, also in medicine book, Harrison also, and a lot of MCQs, lot of questions, lot of concept-based questions are coming from this topic, and it's really a very important integrated topic. So I would like to say there are actually three centers. One center is in the periphery, in the blood, and two centers are actually in the hypothalamus. There are two nucleus for that. So we will discuss one by one, and I hope this is going to help you a lot. Not only in your exam, but also how to decrease your weight, how to increase your weight. Some of you might want to increase your weight, some want to decrease your weight. So there are plenty of behavior which is important to increase or decrease your weight. So there are two types of chemicals or hormones you can say in the blood. One are called as orexins, other is called as anorexins. So orexins are the chemical which increases the hunger, like ghrelin. You must have heard about ghrelin. Ghrelin is a hormone, okay, that is produced to initiate your hunger. How that will be done, I will discuss separately. Ghrelin is a hormone that increases the hunger, and on other hand, there are certain hormones that decreases your hunger. Number one is leptin. Number two is cholecystokinin. And number third is insulin. So insulin, leptin, cholecystokinin, these are decreasing your hunger. Is this clear? Now, this is in the periphery. So how they are going to act? So they have to act on the hypothalamus. They are going to act on the hypothalamus. In the hypothalamus, there are two types of nucleus. One is called as arcuate nucleus. It is a moon-shaped nucleus. You know moon? Okay, moon-shaped nucleus, arcuate nucleus. And other is paraventricular nucleus. A lot of confusion regarding this. Even in the latest INICT AIMS exam, they asked question regarding that. Okay, and many of the doctors marked wrong because there was a confusion. So I will try to discuss that confusion. Number one is that arcuate nucleus. So in the arcuate nucleus, there are two types of neurons. One neuron releases AGRP and neuropeptide Y. AGRP means agouti gene related peptide. Other is neuropeptide Y. So these are actually increasing food intake. These are actually increasing the hunger. So ghrelin are going to activate those neurons which are releasing AGRP and neuropeptide Y. Is this clear? So how ghrelin is going to increase your hunger? Ghrelin is going to increase your hunger by activating AGRP and NPY. NPY. That is why in pharma nowadays a lot of work is done that we can develop NPY antagonist that can decrease hunger and decrease the body weight. So that concept comes from this only, that ghrelin activates neuropeptide Y and and AGRP. AGRP is agouti gene related peptide to increase your hunger. Is this clear? Now, in the periphery, I have told you there are certain hormones that are decreasing the hunger level. One is CCK, cholecystokinin. You know, in the GIT, CCK is to contract gallbladder for the fat digestion, but it has one more significance. It causes satiety. It causes satiety like insulin, like leptin. So leptin, cholecystokinin, and insulin causes satiety. Leptin is released from the fat, actually from the fat. Suppose that if I have more fat in the body, automatically my hunger will be reduced. So it is a feedback mechanism. that if my body is having a lot of fat around the belly or overall the body, these fats secrete leptin. Leptin, what? Decreases the hunger, acting on the arcuate nucleus. And this question was asked in the AIMS. Leptin resistance is because of which nucleus? Answer was arcuate nucleus. Is this clear? So in the periphery, you have leptin, you have cholecystokinin, you have insulin that decreases hunger, causes satiety. On the other hand, you have ghrelin that increases hunger. In the hypothalamus, how they act? Where they act? They are acting where? Which nucleus? Answer is arcuate nucleus. In the arcuate nucleus also, there are actually two types of neuron. One is secreting neuropeptide Y and AGRP that increases the hunger. On other hand, who causes satiety? Answer is POMC cart. POMC, you know? In endocrine, you must have read about POMC. Pre-opiomelanocortin. After this discussion, go to your book, Guyton, and you understand the whole concept. It is really a very important concept. So, the neurons which are causing satiety in the hypothalamus, in the arcuate nucleus, is POMC cart. Pre-opiomelanocortin hormone, and CART. CART is cocaine amphetamine regulated transcription factor. So POMC CART, they are producing satiety in the hypothalamus. Okay, and if you remember in the endocrine, POMC is the precursor of MSH and ACTH and beta endorphin. Pre-opiomelanocortin is the precursor of MSH, melanocyte stimulatory hormone. Okay, so MSH is also producing satiety because it is the finished product of POMC. Is this clear? So again, there are two different set of neurons in the hypothalamus. One is producing satiety, and that is your POMC and CART. Other is increasing the hunger, and that is agouti gene-related peptide and neuropeptide Y. This is clear. This much is clear, no doubt. So one center in the periphery, one center in the hypothalamus, one more center is in the hypothalamus, and the nucleus is paraventricular nucleus. It is called as PVN. Paraventricular nucleus called as PVN. And that nucleus is actually producing satiety and increasing the energy expenditure. So in one line, you can say decreasing the body weight. Why? Because you will not eat food and you will spend the energy. Weight will come down. Paraventricular nucleus. So automatically now you will tell me, what about AGRP and neuropeptide Y? They are agonist or antagonist? AGRP and neuropeptide Y will be agonist for paraventral nucleus or antagonist? Antagonist. Why? Because AGRP and this NPY, they are actually increasing the hunger, and paraventral nucleus is producing satiety. So they will be antagonist. On other hand, POMC and CART and this paraventral nucleus, both are doing the same work. Both are producing satiety. Both are decreasing the hunger. So automatically the POMC neuron, pre-opiomelanocortin neuron, and CART via MSH act like agonist to paraventricular nucleus. This is it. Only this concept, and believe me, there can be hundred of MCQ on this concept. Okay, so now if you open Guyton or the Genome or Harrison, in all the three books, same diagram is given. Okay, so but you must have a clear idea. After this, a short discussion, you will have a clear idea that there are centers in the blood. There are two centers in the hypothalamus. So in the blood, there are the hormones. Certain hormones increases the hunger, like the ghrelin. Certain hormones decreases the hunger, produces satiety, like cholecystokinin. Yes, second is insulin, and third is your leptin. Leptin is from fat. These are the two types of hormones in your blood that enter inside your hypothalamus arcuate nucleus to do their particular work. In the arcuate nucleus, who increases hunger? Neuropeptide Y and AGRP, agouti gene related peptide. And in the hypothalamus, who is causing satiety? POMC CART, pre-opiomelanocortin hormone, and CART, cocaine, amphetamine, regulated transcription factor. Then one more center I have told you in the hypothalamus, that is paraventricular nucleus. It is dealing with the energy expenditure, increasing the sympathetic activity, energy expenditure, and that is why the orexinic neuron will cause, they act like an antagonist, and anorexic neurons like POMC card, they will act like a agonist. Only this is there in the books, but I request you, just you can open, although there is a Sunday, you are relaxing, but while talking to your friend also, you can open Gaitan or Ganon and just have a look of that image, the wonderful image given in the Gaitan and Ganon. Even the GK part it is given. Okay. So when they ask you, they can ask you a long question, a short question, even they can ask you plenty of MCQ regarding that. And after this 10 minutes of discussion, I believe that you will not make any mistake in this topic. Thank you. Thanks a lot.